Hello and welcome to TRAXXfm, and today this is Health on Tracks at 11:17. We are talking about the alarming rise of heart disease in younger Malaysians, something that we all can attest to. We have all heard of the man or that boy who might be in his 20s or his early 30s suddenly passing on due to a heart attack or something of that sort. But today we're going to be talking about that the alarming rise of heart disease in younger Malaysians. Joining us is Dr. David Yong, who's a consultant cardiologist with Gleneagles Hospital, Kuala Lumpur. Hello and welcome to the studio, Doctor. How are you today?
Thank you very much. I'm doing very well. Very happy to be on radio today.
All right.
Talk to you about these heart diseases.
And it's lovely talking to you as well, because I think this is a very important topic, especially right now, considering the rising number of coronary artery diseases. And let's talk about coronary artery disease. Could you explain more on what it is? How do you define it and all of that?
Yeah, okay. Thank you very much for the question. So let's start off by just explaining what is coronary artery disease. So it's a long word. Maybe some might not be familiar with it. Mm-hmm. But basically what it means is blockages that occur in the blood vessels supplying the heart muscles. Mm. And these blockages occurs over years, yeah? And the main factor that contribute to these blockages are actually cholesterol, plaque deposition, or in the arteries. And this build up over years and eventually might rupture and then causes a blood clot to form, and the patient comes to the hospital with severe chest pain, needing some procedure in what we normally call as a heart attack. Yeah. Mm-hmm. So that is essentially what is a coronary artery disease.
So it usually that is your most common how the layman would call it, a heart attack.
Correct.
Right.
Yes. What someone would say a heart attack is actually just a blockage in the plumbing system. Some would say plumbing system, or the blood supply of the heart. Mm-hmm. And then leading to lack of oxygen to the heart muscles and causing injury, and that is what we call normally as a heart attack.
Like for instance, some people can confuse this. Like for instance, like the major blood vessels being blocked, but it's not. It's just some of the vessels that even supplies the heart with blood can be blocked, and that can also cause a heart attack.
Yes, so essentially our heart has three blood vessels supplying it. Yeah, we call it the LAD, circumflex, and RCA. Big terms, we do not need to know them. But any one of it that is blocked, then that would consists of what they call a heart attack.
All right, understood. Right. So, and now we get to the crux of the topic today. Right, it is the rise of heart disease in younger Malaysians. And how young are some of the CAD patients in Malaysia? And you have been part of this environment for a very, very long time. And has there been an increase in heart procedures or angioplasty in recent years?
Yeah. In fact, for the past 20 years, heart disease has been consistently the number one cause of death in the country. And it might surprise you, KJ, that a lot of our patients are much younger compared to our Western or Japanese counterparts. 1 in 4 Malaysians having a heart attack or heart disease are actually below the age of 50. Yeah, comparing it to our Japanese counterpart, the average age of someone in Japan having heart disease is 71 years old. But in Malaysia, the mean age is 56, 15 years younger.
Wow.
Yeah, so that is indeed very scary. And it's not uncommon that we see patients with heart attack coming at the age of 20s and 30s in our country. Yeah.
I can personally tell you, I have 2 friends who one of them passed on, one of them survived due to heart attack, and both of them are below the age of 35.
Yes.
No, sorry, make that 3 people. 2 persons survived. Yeah. But that's the thing, right? The numbers are getting scarier and scarier because I'm 35. I'm worried. I don't have history, but I'm worried. Yeah. As usual, because you never know who's going to get it. Because we've heard of the news. Guy goes to play futsal, passes on, heart attack. Guy goes to do some plumbing system in his house, passes on, heart attack. Simple stuff nowadays, but it's getting scarier and scarier. But as you said, Malaysians, 15 years younger, the mean age compared to our Japanese counterpart. Yeah. Why are we getting it so fast? Well, not much earlier.
I think there's multiple factors that contribute to this. Of course, in Malaysia, our economy has grown, and also unhealthy eating habits is very predominant in our country. We have food easily available 24/7. Easily at the midnight 2 a.m. you can go to the mamak shop and have a very hearty meal, right? Yeah. So I think that is also part of the reasons why this has skyrocketed. So the average Malaysians, 1/5 of Malaysians are actually diabetic. 1/3 has high cholesterol. And another fact today that 60% of Malaysians are actually either overweight or obese. Comparing the statistics from 50 years ago, only 6% of Malaysians are in that category.
1,000% increase?
Yes. 10 times increase, 6% to 60%. So definitely, that is what we call a recipe to develop this disease, and we develop it at a much younger age.
Understood. So would you say that the major issue here is our unhealthy eating habits, or are there any other causes as well?
Well, mainly it is a lifestyle contribution. Of course, there's also genetic predisposition. Some families have higher risks of coronary artery disease because of genetic predisposition. They have some families has very, very high cholesterol levels compared to others. But I think mainly the main contributing factor is actually lifestyle. So such as smoking, high cholesterol, unhealthy eating habits, lack of exercise. People today tend to eat more and move less.
Yeah, that's true. I guess with the improvements of life, the improvements of quality of life, we are essentially shortening our life instead.
Fortunately, I think that might be the case.
All right. Now, as a cardiologist, as a practicing cardiologist, what issues do you face when managing younger patients with CAD versus elderly patients in their 70s and above?
Yeah, so there is a big difference compared when you manage young patients versus older patients. So for older patients, if they are 70 and above and they come with a heart disease, then we need to take care of them for maybe another 15 to 20 years, right? Then by then they'll be 85, 90 years old. Probably at the time, we know there's nothing much else we can offer. But if someone that has a heart disease at the age below 40, then they will probably have to live with it for the next 30, 40 years. And that is a long time. And we want to make sure that the treatment is good and sustainable, and they do not need repeated procedures to treat the same problem. So I think that is the main focus that we have for younger patients that has heart attacks.
Because I think the biggest thing there would be to making sure they can maintain their quality of life.
Correct.
Trying to maintain that their efficiency is not reduced as well. So these are all the key factors that you take into play when you're trying to offer them a solution for their problem.
Also, if you understand, like someone that is below 40, they are active. They are working. And also they want to have an active lifestyle where they want to go for exercises, they need to travel. Then the demands put on the heart is higher compared to someone that are in the 80s or 90s. So that is why selecting the treatment for this group of patients, it's also we need to put into place these factors, take into consideration all these factors and select the correct treatment for them. So that's why we have to look closely and offer the best for this group of patients. Yeah.
Understood. Okay, doctor, what we're going to do right now is going to take a very short break. We're going to listen to one song, and once we come back, that is going to be more to talk about, especially about some of the options available, and that's all happening just about a bit. For all our listeners right there, we're talking about alarming rise of heart disease in younger Malaysians. You can also watch us on TikTok. We'll be able to show you something later on TikTok. If you want a visual representation of some of the options that our doctor is working with right now. Right now, let's go on back with the music. And this is the Black Eyed Peas with Meet Me Halfway. I'll be right back. Hello and welcome back. Alarming rise of heart disease in younger Malaysians. Sounds like clickbaity, but it is the truth. And talking to us today is Dr. David Yong, consultant cardiologist with the Gleneagles Hospital in Kuala Lumpur. So, doctor, you work a lot with younger patients, and considering they are now rising, that is the consensus. What is the best way to treat younger patients?
Yeah, just before coming here to talk to you, the past 1 month, I actually treated 3 very young patients with heart attacks. Yeah, so 2 one is a male, 38 years old.
Wow.
Another female, also 38, and one more male, 34. It's all within the past 1 month. Yeah.
Oh my, that scares me.
Yes.
Anna, be scared too.
Yeah, and all of them have very severe diseases. So traditionally, of course, when we talk about heart disease or coronary artery disease, is usually treated with something we call a stent. I'm sure you have heard of a stent before and know someone that have a stent implanted in them.
Yeah.
A stent is actually basically a metal implant that we use to hold up the artery so that it doesn't closes, doesn't narrows. The problem with stents is traditionally, we know that they tend to have recurrence of the blockage after a few years. And we call it the stent failure rate or target lesion failure. So the failure rate is usually around 2% a year. Okay, so if you could just imagine, after I implant a stent, next year, out of 100% that have a stent implanted, 2 of them will need a repeat procedure. Okay.
Understood,
yeah. On the second year, another 2%. On the third year, another 2%. After 5 years, maybe 1 in 10 will have a repeat procedure.
So you already have the data to back this up.
Correct. Yes, exactly.
Wow.
So that is really a limit in today's technology, where we want, if possible, we want to do it once, do it right, and never have the patient come back.
Yeah, no need to open them up again.
Correct, exactly. So there is now a new technology we call a bioadapter, and this is actually what we try to bring down the event rates for these patients. So I have brought a model here today. This is traditionally what you look like what a stent would look like, holding up the artery. But what's special about this bioadapter is after 6 months, you can see this, linkages. It actually unhinges itself. Unlink itself, allowing the stent or the bioadapter to rotate and also expand and constrict according to what the body needs. So if you imagine your blood vessel is not something that is stiff, it is something that is elastic and able to respond when you exercise. It needs to dilate, and also need to rotate, and your heart is pumping all the time. A traditional stent will actually cage it, limiting its function.
And that is not suitable for younger patients.
It's not physiological. It's not natural for the vessel. And this bioadapter will actually conform or adapt to the vessel, making it one with the vessel and allow it to respond to its natural stimulus. So we know now from good long-term data, up to 3 to 4 years now, that we can bring down the events by as much as 50%.
This is comparison between your bioadapters
with a traditional stent.
All right. No bad.
So we have now latest data, 3 years. The traditional stent stands around 7%. As I told you, 2% a year after 3 years. But in this terms of bioadapter, it's only about 2%. So it's really down. And we see the event rates flatten after 6 months.
What do you mean by flatten? What does that indicate?
The traditional stents every year 2% increase. Right?
Oh, okay.
But for this bioadapter, after 6 months of implantation, we hardly see any more events, any more repeat procedures.
Which means it becomes customized to the body.
Yes, correct. So the main idea here is because young patients need to exercise, need to respond to physical activities. They need to be active, and we do not want them to keep coming into hospital for repeat angioplasties, repeat stent procedures. So I think this is something that we need to look into and offer them if it's suitable. So that's what we aim to achieve with this new technology.
Do you also provide this to older generations?
Yes, we do. if it's suitable and able to suitable for that particular case, then yes, there is no age limit for this stent implant.
So this is purely a cardiologist call.
Correct, yes.
So if you want to put a standard stent, it's a standard stent. If it's a bioadapter, it's a bioadapter.
Correct.
Right. Could you share with us maybe an example of a young patient who you have treated with this bioadapter? How was their response, and how has their recovery been?
All right, so I just share you my latest patient, 38-year-old gentleman came, chest pain for about a week.
Oh wow!
Yes, chest pain. Yeah, and he withstood that. He came in and he actually didn't want to get admitted. But I told him we do some blood tests and it confirmed he had a heart attack. And we do an angiogram and confirm he has 2 severe narrowing. Yeah, and we've treated it with a bioadapter. So there's actually very minimal difference if you treat a patient with a traditional stent and a bioadapter. The recovery is same. Yeah, they can actually get discharged the next day.
Oh yeah,
yeah.
Everything is just through your veins, right?
Veins, yeah, through your arteries, through your veins, and most of the time we use the wrist artery, which is smaller and safer. Yeah, and the recovery is exactly the same. And basically, I give them an MC about a week, then they are back to work, back to activities as usual. And I also like to share that we have been implanting this bioadapter now for close to 2 years in Malaysia. And so far, from my experience, we have very, very minimal rejections or complications and returning patients that need another procedure. So I think this is really something we are very happy about. And we hope to see this continue.
Understood. And so if someone has a narrowing of the veins and all of that, so one of the biggest symptoms, like you mentioned earlier, is chest pain, right?
All right, yes.
All right, so for our listener who actually asked that question earlier, I think that would have already answered your question. Finally, this is a big question, as much as we are indebted to the doctors, to the technology that's already available, but if we can prevent it, that's always better. Prevention is always better than cure. How can we prevent heart disease, and what should patients do if they're already experiencing the symptoms? And maybe you can outline the symptoms a bit.
Yeah. A bit more about the symptoms. I think it's a very important point we have to bring up as well. So the main symptoms of heart disease or coronary artery disease is actually chest pain, or we term as angina. So this is very specific chest pain, usually occur in the center of the chest.
Center of the chest.
Center of the chest. A lot of people think it's on the left side because we think the heart is on the left side. But most of the time, the patients come with chest pain in the middle. And the chest pain, the nature of the chest pain is dull. It's not sharp, not like someone pinching you. You feel a dull pain, a heaviness sensation. I have a patient that described to me, they feel like someone is standing on their chest. Okay, you can imagine that, yeah? And then the chest pain can radiate or travel towards the neck area and also the shoulder and the arm area. Both arms is possible, not only the left arm.
Yeah, we always say if you have a left arm pain and your chest hurts, go to the doctors, right?
Correct. And then they also have some associated symptoms like cold sweats, breathlessness. You might feel giddy and sometimes even feel like afraid, like something is wrong.
Like a fear response.
Yeah, correct. And although these are the classical symptoms, some patients actually come with not so typical symptoms like just indigestion.
Like heartburn
like that. Because the heart is very close to the stomach. So they feel like indigestion. So it's uncommon to just suddenly have indigestion if you never had it before. So you have a history of indigestion for a long period of time, and then suddenly you have the same thing recurring, then maybe it's fine. But if you're in your 40s and you never had indigestion before,
and suddenly you have,
then I think it's very good idea to have a heart check as well.
Immediately.
So I also agree with you, KJ, that prevention is always better than cure. And if possible, we want to prevent this from happening rather than treat the very end of the spectrum, right? So usually I always tell the public that there's only 4 steps that you need to do. Okay, so step number 1 is look before you eat. Which I think is very difficult.
The problem is when I look, I want to eat everything.
So I think another problem is a lot of Malaysians, me included sometimes, we eat first, then regret later.
That is true here.
Like
Anna this morning.
So I think we should educate ourselves in what kind of food is suitable, and also the portion of the food, and of course maintaining a healthy weight and all that. So diet is very important. Number 2 is exercise. Maintain a active lifestyle. 150 minutes of moderate intensity exercise per week. Yeah.
150 minutes, that's 2.5 hours.
Yes, 2.5 hours. Yeah. If you can't do a lot in the weekdays, maybe you can do more in the weekends. And now a lot of people have smartwatches. It can tell you the intensity of your exercise.
Yeah, that's true.
I have a patient also that do their walks on the weekend, early morning in the shopping mall because there's aircon, so it's not so hot.
Okay, all right. Doctor, please break down this myth for me.
Yeah.
If you walk, like for instance, right, in a shopping mall, that is less useful than walking outdoors. Is that true?
No, it's not true. As long as you walk, you fulfill your steps, is okay. The thing is, the walking is not like walking when you go for shopping. The walking we want is a brisk walking.
Brisk walking, yeah.
So fast walking, almost running but not running. That kind of walking, and you can see your heart rate goes up. And you want about 60-70% of your maximum heart rate, which will usually be around 120-130 beats per minute. If you're walking and your heart rate is only 70, you're basically strolling.
That is window shopping only.
Window shopping only, yeah.
If you're doing 120 in a shopping mall, especially if you look like me, people are going to think I'm there to rob the place. So no, I'll do it at the park anyways. Okay, but thank you for telling me that, because I have to tell my wife that. She said walking in shopping mall is different compared to walking outside.
So I think the important is the heart rate, not amount of sweat you produce,
heart
but
rate.
the heart rate, yeah. And also if you walk all around IOI City Mall, it's probably 10,000 steps.
Yeah, I've done that before. Yeah. We had to buy things for the house, so I actually did that. So I got 12,000 steps in iOS City Mall before.
Excellent.
But it took 4 hours.
That one probably strolling.
Strolling, window shopping, buying things. All right.
So and step number 3, Step number 3 is, of course, don't involve yourself in unhealthy habits like smoking and so on. And number 4, I think it's also very important. A lot of times, high cholesterol, high blood pressure, high blood sugar, there's no symptoms. You need to get yourself checked.
Comorbidities.
Comorbidities. So annual health screening, I think, is very important. Do you know what is your cholesterol levels? How is your blood pressure doing? What is your latest weight? And I think you should keep those numbers in check. And if you can find some of the numbers are not good, then you should do something about it before you get some heart disease or something like that. So these are 4 simple steps that I think everyone can follow.
All right. Or step number 6, you can always visit Dr. David. All right. Okay, before we end, Doctor, anything else you would like to add for our listeners?
I think overall, I think the heart disease is a major concern in the country. It's number 1 killer. The heart is working very hard for you every single day. And I think we should know how to take care of it in return. And I also believe that health is an investment, not an expense. People always think that it's expensive to go for health screening and all that, but it's actually an investment for your own self. And I think you will get returns in the future.
You pay for it now. You get your payout after 60.
Exactly.
All right.
And another thing I would like to share is schedule time for yourself. Because nowadays, we are very busy. We have meetings tomorrow, client to see. On your agenda is full, but there's no agenda for yourself.
What is the point of running if you don't have anywhere to run to because your heart gives out, right?
Yes, exactly.
Wow, deep. I surprised myself. All right. Thank you so much, Doctor. Hope to have you again in the future. Maybe we can talk about other issues plaguing younger Malaysians.
Yes.
Maybe something like high blood pressure and all that. But if that falls into your wheelhouse, of course. But you're more than welcome to come here anytime.
Thank you very much, KJ. Thank you.
All right, thank you. And that was Dr. David Yong Tatway, who's a consultant cardiologist with Gleneagles Hospital, Kuala Lumpur. We just spoke about alarming rise of heart disease in young Malaysians. Very important topic. And with that, it's about time we close for today. But I'll be back in the next hour. Don't go anywhere. This is TRAXX FM.